First of all, I would like to take this opportunity to say that I am honored to be your new president. My name is Marie Opatrny, and I look forward to working together as Indiana NASW chapter members. Josephine Hughes, the executive director, wants to ask me a few questions about who I am, as she already knows me, and she knows that I do not like to talk about myself.
Marie, first off, I want to thank you for supporting your professional association in the Indiana chapter by serving as president over the next 2 years. I am very much
looking forward to serving as president of NASW Indiana, Josephine.
Well, my first question is, I want to know what it is you do as a social worker, and I want our membership to know that.
I am currently a faculty member at the University of Southern Indiana in the Department of Social Work, and in addition, I am Director of Field Education. This is I'll be starting my 7th year at USI.
Wow. Tell us a little bit about you becoming a social worker and what your journey was like.
I worked for 13 years as a case manager before I went back to school and received my MSW from Loyola University, Chicago in 1992. And after that, I worked as a program manager while maintaining a small caseload at Trilogy Incorporated in Chicago. In 1996, I started the journey towards my PhD in social work while working as a psychiatric social worker at Vencor Hospital in Chicago. And at this time, I also had a small independent private practice working with my favorite type of client, those with severe and persistent mental illness. After receiving my PhD in 2003, I continued with my private practice until I started teaching at USI in 2004.
What has been your involvement in the past few years with NASW and currently?
I have been a member of NASW since 1994, and I became actively involved in 2004 when a colleague of mine dragged me to my first NASW board meeting. And since that time, believe it or not, I have been hooked, even though we had to leave Evansville at 4:30 in the morning to get to the board meeting in Indianapolis on time.
Wow.
And since then, I have been an active member of the Public Policy and Social Action Committee, and I have served as a Region 8 representative. I served from 2006 to 2008. And presently, I am also serving as a member of the Political Action Candidate Election Committee, known as PACE.
Wow, what a role model you are for the USI students in being part of NASW. So with all that you are doing, do you have time for anything else?
Well, after feeding and walking my 3 dogs, I have 2 mixed breeds that came from shelter, and I have an old Australian cattle dog. I still find time, and after walking them, I have renewed energy to actively participate in the community. And currently, I am one of the lead faculty working with students from Iraq who have spent the past month at USI in a leadership program. Also, I have done a number of social research projects partnering with community agencies, and these include Habitat for Humanity homeowners, generational poverty, and mental health needs of children under the age of 5.
You are a busy woman. So now that you're president for NASW Indiana chapter, what is your vision for our chapter?
As you are already aware, there are numerous issues and ongoing challenges that impact service delivery and affect us as social workers. It is my belief that many of the issues are not insurmountable if we commit to systematically working together. The NASW Indiana chapter and its board have developed an action plan designed to unify and advance the social work profession in Indiana. Membership input was utilized to develop the goals that are included in the Social Work Strategic Initiative. You can find this plan on the web at www.naswin.org. When you're at that website, go to the About Us tab at the top of the screen and select from the drop-down menu the 2010 Indiana Strategic Initiative. This initiative is a living document for the next 3 years. It contains valuable information about social work education, statistics, and practice in the state of Indiana. The board updates this plan in the fall of each year. Just a few excerpts from the plan to capture your interest. There are 10,000 social workers in the state of Indiana. Licensed social workers, 3,387. Licensed clinical social workers, 3,775. Average pay, medical social worker with an LCSW, $51,750 per year. Average pay of individual and family service worker with an MSW and the LCSW is $35,720 annually. And residential mental retardation, mental health substance abuse facility worker with a BSW, $31,550 annual salary. As you read through, you will find at the end of the document the 8 goals and strategies for goal accomplishment that support this initiative. After goals, you will find the feedback form. This can be highlighted and copied for your feedback, which you email or mail back to the chapter office. Let's continue to work together in this endeavor. Your feedback is vitally important to the profession and to me, and I look forward to reading your comments. Your voice will provide us with your perspective regarding the goals and strategies that have been set forth in the strategic initiative. Lastly, I would like to thank you for your support and your continued efforts on behalf of the social work profession. We'll talk with you soon. Marie Opatrny.